Hey guys, Sonia Snowy White 79 here. Trying you on a different position today while I drive, get a little less steering wheel for you. I'm going to do an update on all the appointments I've had lately. I saw my surgeon a week ago today. Today's Thursday the 14th. Happy Valentine's Day. So I saw my surgeon on the 7th, which was just before my 5 months. And it was for my 3-month checkup because it kind of got out of whack with all that, with the issues I had. He was very pleased with the progress I've made. He was very pleased with my blood work. He doesn't want to be involved in figuring out why I'm passing out. So that's it. I met with my nutritionist. She's happy with what I'm doing. So I don't see them again until June, I think, and then I'll be around 9 months. We're just skipping my 6 months since this visit was so close to it, and since I'm making good progress. Then Monday I had to go in and see my PCP because of some pelvic pain I've been having since last Wednesday. She ordered a ultrasound. We figured I had an ovarian cyst or 2. Then Tuesday I had the tilt table test, and so far what they've concluded is that when I pass out, I am passing out because my blood pressure drops and my heart rate drops. That's all I know at this point. I see my cardiologist in about 2 weeks, and hopefully he'll have some ideas as to why my blood pressure is dropping and why my heart rate's dropping, or even if he doesn't have ideas as to why, I'm hoping he'll have a plan to stop it. So Wednesday, which was yesterday, I had the pelvic ultrasound. The tests are negative, so there's nothing abnormal. So now my PCP's kind of stumped as to why I'm having the pelvic pain. She said I could have had a cyst rupture, and it just took long. It's just taking longer to recover than normal. So usually I'm fine after about 3 days, but it's been a little over a week now. After I get off work tonight, I'm not going to take any more of the pain pills she gave me to see if the pain is better. Just can't really tell on the pain pills. And if it is feeling better, then yeah, I'll go with the theory that yeah, it was just a cyst that ruptured. It took longer to recover from than normal for whatever reason. She said with me just being on the mini pill, meaning the progesterone and not the estrogen-progesterone combo, that could make it take longer to dissolve. So another issue from my ultrasound was the technician said she could tell that I had recently ovulated from my left ovary. Well, I'm on the birth control pill, so I'm not supposed to ovulate. It suppresses ovulation. So obviously the pill is not being very effective. So I see my OBGYN a week from today, and we're going to have some things to talk about. And if I'm still having pain at that point, hopefully she can give me some ideas as to why. This morning I had my second post-op counseling session, and she was very pleased. She continues to use words to describe me that make me nervous, and I don't see them in me. So I guess that's like the next assignment, is to be repetitive with the descriptions she uses. Like, she keeps talking about how disciplined I am, and I don't think I'm disciplined. And she keeps talking about how organized I am, and you know, just things like that. So I have to add those to my affirmations and repeat them. And I don't go back to see her for a month, and that was at my request. She felt if I didn't want to come back that I was doing fine. I had made great progress over the last 2 weeks. But I am going to go back in a month. I think 4 visits a year is covered under our employee benefits, so it's not like I have to pay for it at this point. And I just kind of like to touch base and get a outside my world point of view, and you know, So, and she gave me a couple of things to work on, like continue the things that I'm doing from last time, which is focusing on myself some, doing things that make me feel good, that nourish me, not just help me avoid life. So I will keep doing those, and I will work on trying to recognize positive traits about myself. So yeah, that's the update on my world and the world of appointments. Bye, guys.